So good afternoon, everyone. We're going to get started. I would like to welcome you to our June edition of the Dankmeyer Academy. My name is Mary Reedy. I am a certified prosthetist here at Dankmeyer, and our topic this afternoon will be prosthesis hygiene and maintenance. So what I'm going to discuss today is similar to what I inform or educate my patients. So it's very superficial, but we hope that those who are joining us can learn a little and pass this information on to their patients. So let's go ahead and get started. Prosthesis hygiene. So we are working with the amputee population, and those individuals are wearing their prosthesis on a daily basis. Their residual limbs are contained in sockets with layers of gel material, socks, liners, sleeves. And so what's really important is for us to keep this prosthesis in good condition and keep the hygiene going quite strong. So what I like to say is we're going to keep it simple. The more instructions you provide a patient, the more overwhelming it can be. So we're going to keep it simple with what I call the 3 S's: skin, socket, and supplies. So let's dive in and see what we can do for our patients. Skin hygiene is so important for our patients. If the skin is in good condition, they're going to be able to wear that prosthesis majority of the day. And wearing schedule for each individual patient is quite different. Some of our patients are only wearing it for a few hours a day to help with transfers, while we have others who are working, engaging in sporting activities, and maybe wearing that prosthesis up to 16 hours a day or more. So we want our patients to establish a good skincare regimen. So the residual limb should be cleaned daily with soap and water. And that is important, especially once the prosthesis is removed at the end of their wear schedule during the day. We want them to use a soap which is mild and gentle to the skin, and they do not contain strong perfumes or additives. So we have patients that use a Dial or an Ivory, but you again want to stay away from those very strong perfumes and those extra lotions in those soap products. After washing the limb with soap and water, we're going to have that skin dry, and we're going to apply lotion to moisturize the skin. Majority of the patients I work with are diabetic and vascular complications, so their skin tends to be a little bit more drying. So it's important for them to moisturize the skin and to keep it in good condition. So some of the creams that patients will use are Gold Bond, Eucerin, Aquaphor. I usually refer them to their PMR physician, their dermatologist, or their primary care if they do have questions. But those types of lotions tend to be a little bit thicker and stay on the skin a little bit longer. I usually recommend that they put the lotion on at night. It allows that lotion to absorb into the skin throughout the evening hours. But we do have a few patients that prefer a morning skincare regimen. We do recommend that if they're going to be showering in the morning, that at the end of their shower, they just rinse their residual limb off with a little bit of a cooler water. We're not talking about cold ice temperatures, but we certainly want that skin to start to cool down after bathing. And they can apply a very light layer of lotion. We don't want to have too much lotion, because then it can just cause problems in that socket. And if they are going to do this morning regimen, we want them to wait about 30 to 60 minutes before donning prosthesis. Again, allowing that residual limb to cool down, to dry out from the moisture between the shower and the lotions that were placed on it that morning. Another part of skin hygiene is perspiration. Now, we live in an area where our summer months get pretty hot, humid. So patients do complain about, what do I do when I perspire? I feel like I take my prosthesis off, my socks are wet. I have nothing but sweat inside my liner. So there are a few things that we can help our patients control that perspiration. One is just the use of baby powder. They can dust a slight dusting of baby powder on their residual limb, or they can use a topical antiperspirant to control some of the sweating of the limb during the day. We recommend that the antiperspirants be applied on at night. It allows it to absorb into that skin. overnight. If we're going to apply it in the morning, we want again to allow that drying time on the limb prior to donning that prosthesis. But for some patients, they're very sensitive to chemicals. So I like to recommend what's called a patch test. And what those patients will do is they will choose that over-the-counter perspirant. Many of them are Arid Extra Dry or Certain Dry or some common ones that patients do use. And what they're going to do is they're going to take a little bit of that antiperspirant on a small area of their residual limb, about the size of a quarter. And this is an area they're going to put where it's going to be contained within the prosthesis. They'll wear that prosthesis, their normal wear schedule. And then when they remove the prosthesis at the end of the day, they will be able to look on their skin and look for any irritation. If their skin is free and clear, then we know those chemicals in that antiperspirant are not going to bother the residual limb. However, if it is red and inflamed, we know that that patient should not be using that particular antiperspirant. And sometimes discussing that with their doctor about some other options is best for those individuals. So our patients will come in, especially this time of year, with lots of skin irritations with the warmer weather. And also, if they do not engage in a routine regimen of skincare, we can also see these problems arise. So one is some common areas are folliculitis. So that's inflammation of those hair follicles. So if they're not cleaning their limb, dead skin cells, sweat, dirt, debris get into that hair follicle and has this kind of peppery look all over the skin. Another is contact dermatitis. So we look about good hygiene. So if we're not washing our hands properly and we're touching all kinds of surfaces, and touching our residual limb or the rest of the body can actually create some rashing on the limb. And another common is a fungal infection. These are things that I happen to see in our clinic. Unfortunately, with the first two, folliculitis and the contact dermatitis, we usually have patients return to a regimen of skincare such as cleaning. But with the fungal infection, a lot of times we have to refer them back to their primary care, their PMR doctor, or the dermatologist. They usually require prescription grade topical ointment. And if those individuals are wearing gel liners, we also can find that those fungal spores can embed themselves in the liner. So not only are we having to treat the skin, we also are going to have to replace those supplies for the patient. Now the socket, again, part of what's connected to our limb. And so we want to make sure that the socket and the prosthetic components have a routine cleaning. So we recommend cleaning with soap and water or isopropyl alcohol to remove dirt, debris, and bodily fluids. Now we look at the final S. Those are the supplies that we provide our patients. And since those supplies will be used on a daily basis, we need to make sure that they are cleaned routinely. So we have a lot of sock material available to us. And each of those sock materials do have their own specific care instructions. So for new individuals with limb loss, other individuals who have been wearing a prosthesis for a while, they may use a compression sock to reduce limb volume or to help control the limb volume when they're not in prosthesis. And so those compression socks should be hand washed with mild soap and air dry. There's an elastic in those fibers, so we want to preserve that elastic. Putting them into with a dryer and the heat will not allow that elastic to come back, and you'll have to replace those shrinker socks a little bit more frequently. Traditional wool blend socks used by a lot of our long-term patients for many years. And so those wool, we know that wool shrinks naturally. So those socks definitely have to be hand washed with mild soap, such as Woolite and warm water. We definitely want to air dry, so patients can either lay them flat on a towel or they can hang them up on a line. Now we see a lot of cotton and synthetic blend socks, and they are much easier to care for. So you can put them right into your washing machine with your own socks on a gentle cycle using a mild soap and warm water. You can air dry them, or in some cases, you can put them on a low setting of the dryer. Now we see that manufacturers are placing instructions for care of their socks directly on the packaging. So it does make it easier for patients to understand how to care for their prosthetic supplies. In addition to the supplies, we have some gel liners and sleeves. So the gel liner is going to be directly on that skin, and we want to keep that cleaned every day. We're going to invert those gel liners, and we only want to hand wash them with mild soap and water. We're not putting them into the washing machine, and we're certainly not putting them into the dishwasher. Some people might laugh at that, but I have certainly had those cases with patients telling me some interesting stories in the office. And we can't stress enough using a mild soap, such as a Dial or an Ivory liquid pump soap. Antibacterial soap works just fine. We do not want to use the stronger dish soaps or laundry detergents. They certainly have a lot of extra chemicals. And those chemicals can embed themselves in the gel liners and irritate the residual gland. For those who do wear a suspension sleeve on their prosthesis, the great thing is we can just easily keep that sleeve on, but just concentrate on the area of the sleeve that comes in contact with the skin and the thigh area. So we can start out with reflecting that sleeve down over top the socket, and we can wipe it down with a mild soap and water or spray it down with isopropyl alcohol. Again, a routine maintenance of keeping that gel sleeve clean is important for good skin hygiene. And a couple years ago, as part of our summer internship program, we asked a few students to create a video. And so I'm going to share this quick video. It's about 2 minutes, and that we will refer patients to this video from time. It is on our Dankmeyer YouTube channel, along with some other fun videos. So if you give me just a few seconds, I'm going to need to switch screens to share the video.
If you have gel liners, they need to be cleaned daily. First, you invert the liner. This ensures that the inner surface can be washed properly. Add mild soap to the inner surface, then rinse with water. Finally, lay the liner to air dry. Once dry, invert it back to its normal state. At least once a week, the outside of the liner should be cleaned. This can be done in a tub or sink with soapy water mixture. Rinse well. Socks should be washed every day after use. Start by applying mild soap to the sock. Rinse thoroughly with cold water to avoid sock shrinkage and irritation to the skin. Socks can also be cleaned in the washer and dryer on lighter settings. The socket can be cleaned with mild soap and water or with alcohol. Use a few sprays of rubbing alcohol and wipe dry with a towel. A damp paper towel with hand soap is another option to clean the socket. The outside of the prosthesis should be cleaned once a week with alcohol or soapy water to keep up with proper hygiene. Remember, it is important to check your prosthesis and liners for holes or tears. Contact your prosthetist with any concerns.
Okay, perfect. Thank you all for entertaining us with our video. So we're going to move on to the next section after hygiene is prosthesis maintenance. So it is very important for us to evaluate that prosthesis from time to time. You know, our patients wear their prosthesis most of the time daily for multiple hours throughout the day. And prostheses are very similar, that it allows the patient to get from point A to point B. So similar to us driving a vehicle, if we're driving 50 miles a week or 500 miles a week, we're going to notice that our vehicles are going to wear down quite a bit quicker and require more maintenance if we're putting 500 miles on that vehicle. So similar, as patients are walking on a routine basis, if they're only wearing that prosthesis a few hours each day and just walking within the home, they're not going to put as much wear as those of our patients who are possibly working a full-time job, running around caring for their children, engaging in sporting activities. So you think of that step count. How many steps am I putting in that day? I'm certainly putting a lot of mileage on my prosthesis. So it's very important for our patients to come in for routine checkups. We routinely schedule them for a 6-month follow-up. And this is highly recommended for all patients, whether they're wearing it for a short period of time or for a long period of time engaging in high-end activities. And when that patient brings in this prosthesis, we're going to inspect it from the socket all the way down to the foot. We're going to look for signs of wear and possible make recommendations for some repairs and replacements. Most importantly, noises. The prosthesis should not be noisy. If patients are complaining of metal clicking, they see some cracking in their socket, there's an excessive air exchange from any valves or tubes, we really recommend those patients to come in sooner than their routine 6-month follow-up. There could be something that's going on, it could be a sign of failure, so we need to have that inspected. So first we're going to start a little bit at the socket, and what we do is when the patients come in, we're looking for anything called a stress fracture. So that lamination might have a little bit, which might be a little hard to see here, a little bit of white. There's discoloration on the lamination. And then as we take a closer look, we can see that there's actually a crack that has formed. So certainly when we see these things that show up, we want to make arrangements to possibly start repairs or refabricating a new socket. These sockets are built for a patient's activity and weight levels. So if a patient has gained a significant amount of weight, we may need to be able to do some replacements to that prosthesis to support their new weight and activity level. We're also going to, besides the knee, we're going to go in and inspect the foot. A lot of the feet that we use now come apart. So there's a foot module, such as a carbon fiber or fiberglass foot, a spectra sock, and a foot shell. So when the patients come in, we're going to actually disassemble the foot for cleaning. So we're going to start out with the foot in the foot shell. We're going to remove that foot, and we'll notice that that foot is covered with a sock. It's called a spectra sock. That spectra sock will cover the carbon fiber foot, protect it from wearing down the foot shell. And then we will go ahead and inspect that foot. And that foot, we're looking for splintering, delamination of the carbon fiber layers. Sometimes patients will come into our office and say, you know, my foot is squeaking. Well, again, we said that there should be no strange noises coming from that prosthesis. Some patients will describe it as it's wet sneakers walking on linoleum, that kind of high-pitched squeak. And that usually is a common sound that we hear when that spectra stock starts to have holes in it, and that foot shell and the carbon foot are rubbing against one another. There's some other things that we might see when the patients come in. So one thing that we see is rust that can settle into some of the metal components, and this is a rusted screw. So we want to catch that rust fairly early on. This could be a potential big problem. That screw could shear in half, and that pylon that's seated in that tube clamp adapter could start rotating and cause a risk for fall. This is a foot shell that certainly has been out for a while. We'll see that it's cracking down the backside. Once that starts cracking, that foot component can actually come out of that foot shell. We talked a little bit earlier about inspecting that spectra sock. So this is just an example of the wear through of that SpectraSock from that carbon fiber foot. So more than likely that patient is coming in and skiing into our office that day. You can also notice there's quite a bit of dirt on that SpectraSock. So those foot shells are open. So we have found everything from grass to mulch to, believe it or not, pocket change that has worn down inside those foot shells. So it's important to have us be able to take those apart, clean all those components. What we don't like to see, and can sometimes happen by neglect and not providing maintenance to the prosthesis, is a broken pylon. This is actually one of my patients who came in a few months ago. He was new to me, but he's actually not a new prosthetic user. He's been an amputee for quite a few years, but he did tell me that this prosthesis was provided about 5 or 6 years ago, and after he got the prosthesis, he never returned to the prosthetist. So there was no one to inspect to make sure that if there was some cracking, some wear to those metal components, the patient did fall. He did not injure himself, but again, we don't want to have those problems. We try and check things early on and keep our patients safe. Another portion of it is just replacing our supplies. So here in the picture, we can see that there's a brand new liner, and then the liner to the right is after 6 months of use. So patients are donning these materials every day. They're inverting them, they're rolling them on. With time, those liners become outstretched. So they're not supporting the residual limb as much as it should. Also, you might notice how the material is stained. That could be anything from urine to fecal matter if they're not being properly cleaned. Dirt and debris. So we will sometimes also see when we invert those liners that the gel material starts cracking. When it starts cracking, it can cause some irritation on the residual limb and result in some skin breakdown. So again, when those patients come in to do their routine follow-up appointments with us, we're not also looking at that prosthesis from socket to foot. We're actually inspecting all of their supplies. And those supplies, or we also known as consumables, are socks, liners, and sleeves, and they are going to wear out with daily use, as we see here with the liner stretching out. The suspension sleeves will actually become too loose up on the thigh, so we can lose, especially the vacuum suction system, we can lose that support and the suspension. The prosthesis has an opportunity to fall off, cause a risk of fall if we don't replace those sleeves. Also, the prosthetic socks, we're laundering them on a routine basis. And with any sock material, that material is going to wear down. So when the patient received that sock, and it was more of a 5-ply fit, it's now closer to maybe a 4 or 3-ply fit. So we definitely want to make sure those socks are replaced. And we recommend replacing those supplies every 6 months. And again, it depends on the use of the patient. So those more active patients, sometimes we'll see them in about 4 or 5 months to do those replacements, but a routine 6-month replacement of supplies is just a good general rule for our patients. Most insurances will provide a benefit for replacement supplies. So we find that replacements every 6 months, again, is a very good routine. However, some insurance companies do limit annual quantities. So that is certainly a discussion that the patient should have with the prosthetic office to make sure that they're getting the supplies they need, and if they have insurance coverage for that. So there's not much on this topic today, but just wanted to do a brief review of maintenance and hygiene with wearing a prosthesis. So I'm going to open it up to any questions that you might have today. So no questions for this afternoon. As always, if you have patients who have questions, or you're a physician, a nurse, physical therapist, we're happy to answer those questions for you. Please feel free to reach out to us. And I hope everyone has a wonderful afternoon. Thank you for joining today.